beautiful humans, Dr. Forum. This is your Metabolic Minute. Did you know that your metabolic health started before you were born? Yeah, it starts in utero. It's something called fetal programming. Depending on the blood glucose that the baby is exposed to, that'll determine which genes are expressed. We know from the Dutch famine studies that those babies that were born that had really high or really low birth weights went on to have more chronic disease than those babies that were born with a normal birth weight. Likewise, we now know that 1 in 5 pregnancies is complicated by gestational diabetes. And if a woman pre-conception has a BMI greater than 30, that puts her at 5 times the risk of developing gestational diabetes. Mums with gestational diabetes are at a higher risk of having large birth weight babies, macrosomia, requiring C-sections, and sadly even an increased risk of stillbirth. The babies are also at a much higher risk lifetime of developing either obesity, diabetes, or other chronic diseases. We know high blood glucose is a teratogen, meaning that it affects organ development. So everything from cardiac, neural, musculoskeletal, and genitourinary defects can be caused by high blood glucose. We know that as the mums consume more carbohydrates, so does the baby, because the placenta does not filter glucose, and then the baby's own pancreas makes extra insulin to deal with the high blood sugar. There is no evidence that mums need more than 200 grams of carbs per day, and as a matter of fact, many women thrive at 100 to 150 grams per day, choosing real food options. There are so many nutritionally dense superfoods for mums and babes. Eggs, seafood, full-fat dairy, none of this low-fat stuff, please. Liver, bone-in roasted meats. And as these miraculous mamas are growing a whole new human, they need more protein, at least 1.5 grams per kilogram, especially in the second half when that baby is really putting on some pounds. For those that care, I would highly recommend anything written by Lily Nichols. She is a nutritional superstar, especially for women's health. Oh, I hope you're being good to you. You are pretty darn important. Food's a tool, not a weapon. Take care, like, share, and send this to a mama who's cooking up a whole new human. Thanks. Bye-bye.